The top stories of the week with added depth and also context from our team of reporters we here like to call the Daily Debrief. Hello everyone, I'm Ty Quinones. Well, viewers like you are asking for more depth, and here is exactly where you're going to find it. So let's jump right in.
If you're inside and there are several people around, mask up. That is what the Southern Nevada Health District is recommending now that COVID-19 cases and hospitalizations are rising in our county. The recommendation includes masking up inside grocery stores, malls, concerts, large venues, and casinos, since health officials say the COVID-19 virus is more easily transmitted indoors.
One of the challenges with the current recommendation from the CDC for vaccinated individuals is that nobody has the authority to actually ask a person who is without a mask whether this person is vaccinated or not vaccinated.
Dr. Fermin Leguen also says that in order to make it a mandate, it will require other entities to participate.
The county or the state or the cities. The health district itself doesn't have the authority to implement a mandate of this nature. So that would be something that we have to be in collaboration with the local authorities here.
Local doctors who are seeing the rising cases and hospitalizations agree with this measure. They say more events are happening in our town with large crowds, and having a vaccine doesn't mean that you can't get COVID-19 or that you produce the antibodies needed to fight the virus.
There are certain conditions that that make it difficult for the body to make antibodies to the spike protein. So I think it's a good move for Nevada and a good move for Las Vegas to avoid another shutdown.
To mask up again or not, that's the dilemma many are facing now that the Southern Nevada Health District is recommending both vaccinated and unvaccinated people wear one if they're inside in crowded spaces. That means public spaces like grocery stores, casinos, arenas, and stadiums. While this is still a recommendation, the mask decision is up to the people.
In a big, by a close environment with a lot of people, we're gonna use it,
I'm not gonna wear a mask. I choose not to wear a mask unless, I mean, we went out before when you had to wear a mask to the casinos and stuff when we wore them, but it was just, to me, it was just a control thing. My family's not going to wear masks.
We never should have given it up in the first place. I am vaccinated, but I have not given up wearing my mask. I have a 10-year-old granddaughter that cannot be vaccinated. She lives in my home. So we're trying to protect her as well as even me.
For others, there is confusion about the vaccine's effectiveness, since some decided to get it in order to avoid wearing masks. Dr. Brian Lavis, an infectious disease epidemiologist, says that the guidelines keep changing because the virus keeps mutating, bringing more strains, which requires different measures.
It is a challenge to get people to follow on those things, but the problem with the changing guidance is we're doing that because the virus is changing. We have a different enemy now than we had months ago with the new Delta variant. And so because the virus itself has changed, our recommendations have to change along with that.
I'm CIARA White-Sparks here with 13 Action News reporter Astrid. And Astrid, your story today was about the new indoor mask recommendation here in the Valley due to the recent rise in COVID cases. For the mask recommendation to become a requirement indoors, what process will officials have to go through?
This is just a recommendation. It is not a mandate because the Southern Nevada Health District does not have the jurisdiction to make it a mandate. That will have to actually come from local authorities or maybe the state or even the CDC or nationwide. But this recommendation comes after our COVID-19 cases have been going up in a really fast way. We have to remember just months ago, we were under the 5% everybody kept talking about. Now we're back into the 10, 11, 12, which means that our cases are going up the roof in a very fast way. And health officials are hoping that now if people wear masks when they're indoors, when they're around a lot of people, and when they're large crowds or they're going, to events or parties or other situations like that, they hope that the numbers are gonna start going down because right now it's not the COVID-19 cases that are only going up. We're talking about hospitalizations. And to know that a lot of the people that are hospitalized right now are unvaccinated, it definitely put things into perspective. It's not that the vaccine is not working. It's just that, first of all, a lot of people need to be vaccinated. But second, the vaccine protects you to a certain point. The vaccine protects you to not end up in the hospital. It's not against COVID. And now we're seeing that now with the Delta variant, our cases are just going really up high. So at the end, it's a personal choice, but your health situation, your family health situation, or your loved one's health situation should also be taken into consideration if you want to follow this recommendation or not.
What type of challenges do you think this new recommendation will bring, especially for those who have already been vaccinated?
Well, we have to remember that one of the reasons why people wanted to get vaccinated, it's so they wouldn't have to wear a mask, because that's something that it was told before. But as we know right now, the vaccines have a certain degree of effectiveness depending on which variant, because the virus has been changing, basically, has been mutating. And that is the challenge, because that's why the guidelines, at least that's what health officials are saying, keep changing. Because it's one thing when we had, the UK variant, with another one when we had, the South American one. Every single one has different situations, or it's basically translate different on each and everyone's body. So therefore, if there's another big variant in the future, the guidelines could change again, or maybe even become mandates. Maybe we're gonna be moving forward. Maybe we're gonna be moving backwards with the guidelines, with the mandates. I mean, hopefully we're not gonna go through another shutdown. I think nobody wants that, but that is why it's important to bring those numbers down. That's why they're asking not only, hey, please go and vaccinate if you're allowed to, if you're eligible to do that, but also, wear your mask and avoid large crowds. Now, I know there's a lot of questions and misconceptions about the vaccine and even about each one type of vaccine. But at the end, what health officials are saying is that vaccines work. They're helping people to avoid hospitals. And we have to remember, even if you are vaccinated, you can still get COVID. You most likely will be asymptomatic, but you can still spread the virus to other people. So that's why it's important to have this combination, vaccines and masks.
And after chatting with health professionals, what protocols should residents expect within the next few months?
Well, that's the thing. We have to remember that when there's a change in policy, guidelines, mandate, or however you want to call it, it takes some time to show up in the numbers, in the metrics. The same thing happened when the mask mandate was taken away. The same thing happened when vaccinations were allowed for teenagers, and the same keeps happening every single time there's a change. So it's really important to see how those numbers are going to translate in the next couple of weeks. We're definitely going to see in the next few weeks, maybe a month, maybe two, if this mask recommendation, if it stays that way, is actually effective or not in bringing those numbers down. So that's why, health officials keep emphasizing, please take action, please take care of yourself, and not only of yourself, of others too, even if you don't know them. And the way for them to do that is to vaccinate yourself and to wear a mask.
The Southern Nevada Health District is recommending that everyone wear a mask, whether you're vaccinated or not. And here at Westgate, they're requiring that all of their employees wear masks.
Very tough decision, but we really feel that that's what's best to keep our team members and our guests as safe as possible.
Masks are back over at Westgate, Las Vegas. The policy reinstated for employees as the spread of the coronavirus Delta variant rages across Southern Nevada.
We're going to have to, as a business community, collectively figure out how do we get this thing turned around.
Statewide, the test positivity rate in COVID-19 cases continues to skyrocket, spiking to 11.3% in the past 2 weeks. The Southern Nevada Health District recommending that all individuals, vaccinated or not, wear a mask in crowded public settings. That includes grocery stores, malls, large events, and casinos.
And everybody, feels they can police the ones that haven't been vaccinated, but it's really difficult to do that. And there's so many guests that are coming in that aren't vaccinated.
Westgate VP of Public Relations and Community Affairs Gordon Prouty says they offer vaccinations on site for their team members while educating, encouraging, and incentivizing their employees to get the shot, a shared position by the Culinary Workers Union.
We've held town halls in English and Spanish. We've sent hundreds of thousands of texts and emails to members and non-union workers educating them about the vaccine. The vaccine is safe, proven effective, and we will remain vigilant to ensure workers are protected at work.
Protecting their employees and guests is what the Westgate says is a top priority, calling their team members the heartbeat of the property.
We've got to keep this momentum going. The last thing we want to have to do is step back.
And we have a list of vaccination sites on our website. Just go to ktnv.com. Reporting, Rachel Moore, 13 Action News.
The health district recommends everyone wear masks in crowded indoor spaces again. And some casinos actually said they're going to require masks for both guests and employees, whether or not they're vaccinated. I'm with reporter Rachel Moore. Rachel, which casinos have changed their policy?
There are a couple of casinos and resorts that have changed. One that we heard back from was the Sands Corporation, so the Venetian and Palazzo. And then I went over to Westgate Las Vegas, and they have already changed their mask policies for their employees.
How do employees at those casinos feel?
When I spoke to the public relations person, he told me that what they're doing is really for the safety of their employees and their guests. They are encouraging their employees to get vaccinated. And when he spoke to one employee who wasn't really sure about whether he wanted to get vaccinated or not, because there's a lot of mixed messages going on out there, a lot of misinformation happening. So when he spoke with them, they're doing all that they can to educate them. And one of the other things that they're doing is making sure that their employees know that their employers are getting vaccinated. They're making sure that they know that, or setting an example rather, that they have their vaccination card. They want them to do this. They want them to be safe. And that's really how the feel of it. They say a lot of their employees are vaccinated though over at Westgate.
On the employer side of this, what seems to be the consensus? Does it feel like this is one step backwards, or are they happy to see recommendations in place?
So that's why Westgate really jumped on it. As soon as the health district recommended to wear masks, they mandated it in their casinos for their employees because they don't want to go back to a shutdown. They can't afford it. Their employees can't afford it. And so they are trying to get ahead of this. They're trying to be an example to the rest of the casinos in Las Vegas to just show that this is masks work, vaccines work. This is what we have to do as business leaders. This is them talking. This is what we have to do as business leaders to help the community move forward.
We'll be back now with more of the Daily Debrief after the break. And welcome back to the Daily Debrief, an in-depth look at the top stories of the week. For more details on any of the stories that we're talking about here, just head to ktnv.com.
It's going to take much more than a monsoon to even break the ice on ending this drought.
Think about it, if you didn't get paid for 3 months and then, your employer gave you a normal paycheck and said, okay, now we're back to normal. Well, you're back to normal for that paycheck, but you're not back to normal for those 3 months of pay that you lost.
Lake Mead reached historic lows last month with the threat of water shortage looming. High elevation snowpacks are well below normal for much of the West and pretty much gone for Sierra Nevada. Snowmelt is the #1 driving force in keeping water reservoirs full.
We are not seeing typically the snowpack in the winter season, which generates most of the runoff, which fills the reservoirs. People can assume it'll rain and fill the reservoirs, but that is going to take a lot of rain.
Most of our region's water comes in the form of snow. When we experience snow drought, there are devastating economic, environmental, and social impacts.
Greater flood risk during the wet times because that snowpack is less reliable, and it means that we have less water supply in the dry times because that snow is not there in the same quantities or reliability.
As global and local temperatures rise, less of that precipitation drops in the form of snow, and high winds can cause snow to evaporate.
This year was actually forecast to be the third lowest runoff for the entire Colorado River Basin.
I'm Jason DINANT here with 13 Action News reporter BREE Guy. BREE, your story today was in regards to the drought and how much water it'll actually take to help us get out of this drought. Can you kind of recap your story for us?
So that answer, a lot of people, especially after we have been experiencing some monsoon action here over these last few weeks, it's not a simplistic answer in terms of just like we need more rain. Most of our water supply comes from snow melt in the snowpacks. And so, yes, the rain is beneficial, but right now it is mostly going towards replenishing that soil moisture and not necessarily going into our reservoirs for our water supply.
Now, when you say snowpack, what mountain ranges actually go into Lake Mead? And is there anything that says in the future, in the forecast coming up for this winter, that those mountain ranges will get more and that Lake Mead will benefit from that?
Yeah, so the Colorado and Utah mountains are the snowpacks that flow into Lake Mead. And it is too early to forecast for the 2021-2022 winter in terms of what we are expecting to see. Overall, though, because we have seen a substantial decrease in that snow that has fallen up there and in those snowpacks, that is partially due to local and global rising temperatures, as we have just and also just with like those temperatures continuing to rise, then that snow isn't necessarily sticking. So we don't really have a lot of snow and a lot of snow runoff or snow melt to kind of replenish Lake Mead, which is why they are calling, that's why it's been a decades long drought.
Now, it's been interesting. I've lived in Las Vegas for many years. And in the past few years, it seems like summers are getting hotter, but then we've also seen more days where we've had snow actually here in the valley or up at Mount Charleston. Is any of that snow that's been falling helping with this drought at all in any way?
Yeah, so I guess like this is also can relate to your last question on weather versus climate. So climate is what we expect, like seasonal changes over a 30-year climatological period. Weather is just what happens day to day. And so the snow that we have necessarily been seeing like this past winter and the, I believe, winter before that, I was not here in Las Vegas, is more correlated with weather. It's not necessarily a climatological impact. And there, of course, any rain or any precipitation has benefited from snow, the rain, and anything. We'll take anything, we'll take any water, but it just hasn't really helped in making a big dent in that, because again, we really need that snow from the Colorado and Utah mountains just for that gradual melt off that we need to kind of fill our reservoir that we depend on.
We'll be back now with more of the Daily Debrief after the break. And welcome back to the Daily Debrief, an in-depth look at the top stories of the week. For more details on any of the stories that we're talking about here, just head to ktnv.com.
A lot of the families in the valley have been trying to cut back on spending in order to weather the economic fallout of the pandemic. The families I talked to say they're glad there's some money from the government coming in.
Billions of dollars coming to Nevada families in the form of child tax credits. That includes Lorena Llamas of North Las Vegas. She'll be getting $500 a month for her 2 teenage children.
Right now, we're probably going to put that money towards savings. I know the kids are going back to school here soon, so that'll definitely help out with that.
Llamas says she and her husband have been fortunate keeping their jobs, but had to deplete their savings to stay afloat.
that well ran dry a little bit. So now it's kind of like playing catch up, especially when we got our taxes and stuff like that.
Ariel Davis, who also has 2 children, says the money will be a difference maker.
Food, just basic necessities, actually, because that was money that came out of my check.
More than 330,000 families in Nevada are set to get a check from the federal government. Senator Catherine Cortez Masto says this is an investment in working families.
I have heard from so many families throughout the state of Nevada that we're on tough times. So that's why it was important for me to support this legislation, to support the child tax credit.
Yamas says families who get the payments should make sure to spend it wisely.
Make sure that your bills are paid. Make sure that your pantry's full. Make sure your fridge is full.
Right now, there is legislation to have the child tax credit payments to continue after this year. However, it remains to be seen if it will be passed. Jeremy Chen, 13 Action News.
We'll be back now with more of the Daily Debrief after the break. And welcome back to the Daily Debrief, an in-depth look at the top stories of the week. For more details on any of the stories that we're talking about here, just head to ktnv.com.
I'm CIARA White Sparks here with 13 Action News reporter Jeremy Chan. And Jeremy, your story today was about the new federal child tax payment that will be available in Nevada starting today. With the additional payments, how will this extra money benefit families during this time?
Well, that's a very good question. The families, at least I talked to 2 families. Basically, one of them said, they depleted their savings during the pandemic, and the extra $500 they're going to be getting each month is going to help replenish that rainy day fund, just in case they have some sort of unexpected expenses. For the other family I talked to, the mother pretty much said that money is going to be going to the basic necessities, food, school supplies, because they're going to be going back to school pretty soon. So basically, from what it looks like, it's either saving the money or going to, pay bills or food or other basic necessities.
And how did the American Rescue Plan make this initiative possible?
So when the American Rescue Plan was passed and signed into law earlier this year, it provided a bunch of money, a bunch of avenues to all different sectors in the American economy. For people like you and me, we likely got our third stimulus check from that same bill. The same bill also provided billions and billions of dollars for the child tax credits. Therefore, they'll be able to get those payments. So it's thanks to that particular law, a lot of families, so many families in the United States are able to get this particular money, and that's going to last until the end of the year.
And how does the child tax bill differ from the stimulus checks individuals have received in the past?
So pretty much the defining factor that separates the stimulus checks from the child tax credits is the fact that individuals who have no children will not be able to get this money whatsoever. In the past, basically everyone, whether you had a child or not, got a stimulus check if they qualified for it, of course, by their income levels. But this time, it's only pretty much parents or single parents or someone who's, taking care of a child, in some capacity. They will be getting those checks this time.